Welcome to part 3 of assessment of muscular fitness. In this particular section, we're going to talk about all the additional strength testing protocols that I believe should be a part of all testing programs once you get past the basics and independent of what the ACSM has you test for. Now, before reviewing any of these additional tests, I really want you to note the following, and they were mentioned in previous presentations but weren't defined completely. And this, when you're going to do, before you do any kind of testing, you need to do the following. You need to do a postural analysis. You have to look at anterior, posterior, and lateral views. You have to look at the range of motion at all the major joints. And this is based on Kendall's book on muscle testing and function. You also need to do strength testing of various muscles in all the numerous system. This is also based on Kendall's book as well. Then, after you take those three into consideration, you need to look at the variations of the numerous types of movement screens that are out there. Because when you do these movement screens, all the previous tests you have done and the data you've collected on any kind of deficit you found will show up in these movement screens. Now, all these tests should precede any of the following tests that we're about to review. And they're going to give you the information and knowledge to be able to identify and verify numerous types of strength deficits. And when you identify these deficits, it can facilitate any kind of corrective exercise protocols and training regimen you're going to give these people. Now, when you do this, you should always consult and work with the proper professionals that are skilled in corrective exercises and any kind of posture analysis or any kind of physical therapy. And this will help you supplement and improve your knowledge and, more importantly, help you improve all the strength categories for anyone you are attempting to help. Now, the previous tests only give you a hint of what a participant is capable of doing. You need additional strength testing data from a few basic movements, i.e. basic human movements. Squatting up and down, deadlifting, lifting and carrying movements or objects, bending and twisting, pushing and pulling. These basic movements will help you identify various strength category deficits. And if you remember back, the strength has multiple categories like skill strength, flexibility strength, and estimates on absolute strength from the endurance test as well. And these basic tests include upper body testing. You did the push-up before. Now we're going to go beyond that. We're going to look at like the overhead press behind and in front of the neck, any kind of pull-ups or their variations, and rowing movements. Because if you think about it, if you do push something overhead, you got to pull something down. If you do a push-up, you're pushing the body away from the ground or pushing a bar away from you. But you also have to learn how to pull something toward you as well. So if you look at it, these are opposite movement patterns. They're going to help give you an idea of pushing and pulling movements and see where there's a strength deficit. We're also going to look at lower body testing too, like a deadlift. That's a basic human movement, picking something up from the floor. And another variation of a deadlift is box lifting, picking a box off the floor. Now think about it too. If you have children, you squat down, which is a basic human movement, and then you pick them up. But you have to be able to do it in the right way. We can also do body weight squatting for repetitions. Now, if you look after that, then we have various types of squatting after proper technique is taught and adhered to. And finally, we have trunk or core testing. And we're going to look at full curl-ups, which are going to look up the upper abs. We're going to do lower leg testing for the lower abs, and then we're going to do a variation of both of those. Now let's look at upper body testing. You must test all opposing movements like we just talked about to determine strength deficits in various opposing movements. And again, examples are like a push-up versus a rowing, an overhead press versus a pull-up. So you can see the opposite movement patterns must be tested to see what your strength deficits are. The first one is behind the neck press. It's an upper body pushing test. If you look at our subject here, in A, she has the bar placed on her upper trapezius in a snatch grip position. Now, for those of you who are using CrossFit-like workouts, you need to be able to See whether your clients or anybody that you're helping has the range of motion in their shoulder girdle and shoulder joint. Now, once she has the bar in her back, she's going to pull the elbows forward to align the elbows and hands in a vertical alignment. The elbows should not be pointing back. If the bar's lower on her back, like in a powerlifting squat, yes, the elbows will rotate upward and back to make sure the bar stayed on there. But for this particular movement, the gravity's going straight down, so her hands and elbows should be lined up accordingly, opposing gravity. Now, she's then going to push the bar overhead with her arms fully extended. This is figures B and C. Now, you need to perform this movement with light weight to check technique and look at some strength endurance. Once you teach them this movement, you can also do like 10 reps or better to see can they do it in a controlled fashion. Now, this test examines upper body pushing strength and verifies any range of motion deficits that you found in the shoulder joint and in the shoulder girdle and the flexibility and any kind of range of motion examinations that you did for the upper body. Now we have the upper body push test and the overhead presses in the front. We look at the starting position. You have to address the bar on either squat stands or in a power rack. The bar height should be just about below the top of the shoulders, so you can get up underneath the bar and then grab the bar with a closed pronated grip, and the grip should be slightly wider than shoulder width. And the elbow should just be in front of the bar. And in this position, you'll push the bar upward until the elbows are fully extended. If you look at figures A, B, C, and D, figure A is the initial drive off the shoulders. Figure B is in the mid position, figure C is the finishing position, and figure D is the path of the bar. Now, when you first start this motion, you're going to pull your chest up and pull your head slightly back to allow the bar to pass by the face as it is raised up or pushed up. You don't want to go out and around. You want to go up and back slightly. You want to keep the wrists stiff and the forearms parallel to each other. Now, let's look at the upper body pulling test. If you can do a pull-up, see if one of your client or all your clients can do this. When you're hanging from a pull-up bar, the first thing you do, if you look at figure 2, this person is, first of all, they're going to depress the shoulder blades because that sets the shoulder blade so the humeral head can rotate and that glenoid fossa appropriately. Then he's going to pull himself up where the chin is just over the bar, but also notice too that his hands and elbows are lined up appropriately. They're in a straight line. Gravity's going straight down, so once again, if the elbows and hands are lined up, that means all the load is going to the lat muscles, is what you're trying to test. And then you're going to lower the body down slowly. Now in a pull down, let's look at the starting position. It's a lot like the pull up, but what he's going to do is going to grasp the bar in a closed pronated grip. The grip should be a little bit wider than the shoulder width. You're going to sit down on the seat facing the machine. Position the thighs underneath the pad with the feet flat on the floor, and then you adjust the seat and thigh pad accordingly. You maintain an erect position with the elbows fully extended. Do not lean back on this position, because every time you lean back, it changes the muscles utilized in this particular movement pattern. If you start leaning back, the lats aren't as involved, but the upper back will be. You're trying to directly oppose the pushing overhead movement by pulling down in the same plane of motion. And the first thing you do, you're going to shrug the shoulder blades up, and then you're going to pull them down like in the second position. So you can see in the first picture, he pulls the shoulder blades up. In the second picture, he pulls them down, just like they did when you did a pull-up, because that's actually a normal movement pattern when you're trying to do a pull-up. The shoulder blades will be pulled down to set the shoulder blades so all the load goes to the lats. This is the set position for the pull down. Now the downward phase, he's going to pull the bar down, keeping his elbows and hands lined up directly. So you look at position A. The cable is, the resistance is going up, and you want to directly oppose the resistance by keeping everything in line. This is called a parallel force system. You're going to maintain an upright position. Shoulder blades should remain depressed, which means pulled down and fixed. Keep the hands and elbows aligned up vertically through the down phase. You're going to pull down just below the chin. The bar is pulled down until the elbows begin to drift behind the hand position. But that's what you want to keep from doing. You see a lot of people in the gym will pull down, and they pull it all the way down. Their elbows start doing the shoulders will start doing internal rotation, and the elbows move back behind the body. You don't want to do that. Now in the upward phase, allow the elbows and shoulder blades to return slowly to the starting position, and in the whole movement, you keep the torso in the same upright position. Now, upper body pulling test. Now we're going to do wide grip rowing. Now, before beginning, you have to grasp a bar with a close pointed grip, with the grip a little wider than shoulder width, and that's in position A. And you have to lift the bar off the floor as described, like in a deadlift exercise. We'll get to that later. But you use a pronated grip. Stand all the way up. Next, you're going to position the feet in a shoulder width stance with the elbows slightly flexed. You're going to flex the torso forward so that it is slightly above parallel to the floor, as in position B. The back has to be flexed. You're going to create a flat back torso position. So the knees are bent a little bit. You're going to stick your butt back, almost like doing a stiff-legged deadlift. Focus the eyes a short distance ahead of the feet. Allow the bar to hang down with the elbows fully extended. The upward phase, you're going to pull the shoulder blades together. You're going to squeeze them together, which is called retraction. Then pull the bar toward the torso. You're going to keep the torso rigid, the back flat, and the knees slightly flexed. Do not jerk the torso upward. You see a lot of people in fitness centers that when they're doing these movements, they'll jerk it and they'll extend the trunk to try to get momentum to the bar to pull it to their chest. Do not do that. You want to touch the bar to the middle to lower parts of the chest. So you can see, look at where the elbows and hands are. They're directly lined up going against gravity because you're testing the upper back muscles. The rear delts, traps 2 and 3, and the rhomboids as well. Now with this, with a light enough weight, what you're trying to do is perform about 10 reps with really good form. This test will end when the form disintegrates, the torso moves up to a more upright position, and the elbows and hands do not stay aligned. Now for lower body, we're going to start with a body weight squat test. It's a bilateral body weight squat that can be described as this. You're standing, flexing at the knee and hip joints, and descending until the top part of the thigh at the hip joint is lower than the knee joint. And yes, for those of you who work in the aerobics industry and teach group exercise and all that, and even for personal trainers, you've always been taught that the knee should only go to about a 90-degree angle. This is absolutely false, and the range of motion at the hip is approximately 120 degrees, with the range of motion at the knee joint approximately 140. You need to move each joint through its maximum range of motion. So once you get to this, then you get the hip joint is lower than knee, then ascending by extending the knee and hip joints to return to the starting position. Each of the major joints of the lower body, the foot, ankle, knee, and hip, and the lumbar and thoracic spines of the upper body requires degrees of stability and mobility to ensure a competent squat pattern. Now, if you go back to all your other tests, if you've got deficits in flexibility at the hip, knee, and ankle, they'll show up right here. Now, let's get a note on squat stance and foot angle. The stance width should be individualized for all squatting movements based on individual human constraints, specifically body type or segmental lengths. When adjusting foot stance width, it is very important to ensure that this foot is lined up in the direction the kneecap is pointing. Not having the feet and kneecap aligned may cause excessive torque in the knee and limits range of motion at the knee joint. So you can see in the picture, every time when you start moving your knees outward from a standing position, if you look at the knees and toes are pointing straight ahead, but as you move your knees away from each other, what happens? Your feet should be aligned properly, as in these pictures, that the kneecap and feet are completely aligned. Now, when you're doing a body squat test, the test will start with a narrow stance position to identify range of motion at the hip, knee, and ankles. Then you can identify optimal stance width for the individual, especially if you're going to go on to do a regular loaded squat test. You have to see what the range of motion is like first. Then you move the feet out to see where the lines of force are going to be from external loads. When we do our squat test, I'll show you this. But once again, it's okay for you to do a full squat movement with body weight and even with a loaded bar on the back as well too. One great example is in Asian countries when what they call a third world squat. These people over there actually will rest in this position. Their trunk is upright, their knees are over their toes, and they're sitting upright, and they don't have any problems with knee joints. If you look at Olympic lifters, they always do this too. When they explode up, trying to get the weight to move up, they'll move underneath the bar in a full squat position. And believe me, Olympic lifters have some of the lowest rates of knee injuries in the world, and they go through full range of motion. Now the starting position, stand with the feet approximately shoulder width apart and arms extended. Squat down to the position where the tops of the hips are just below the tops of the knee, or you can even go lower. The back must remain flat, and you have to look for a neutral pelvis. If you get to the point in any part of this test and the pelvis starts tucking under, that's when you stop the test, which means there's a range of motion limitation that's causing the pelvis to tuck. And you also want to keep the feet flat on the floor. That's why if you still have a neutral pelvis, your feet are flat on the floor, your trunk is still in a flat position, you can go below, way below parallel, but you want to see where the pelvis starts to tuck. Now, you can look at the range of motion first, and then you can perform this movement continuously for 1 minute to see what happens. Record the number of squats completed for use during the following test. The test should be discontinued if participant cannot maintain correct position, flat back, neutral pelvis, feet flat on the floor. Repetitions not below parallel are not counted. Now, the lower body squat test may be used if body weight squat test determines range of motion and stability is good. And also, too, does the participant have previous experience performing squats? If they have, then you can go back and really evaluate what the range of motion is, and then start doing these squats tests with light weight to see can they maintain this particular movement pattern through full range of motion and keep that technique. If not, then you have to either lighten the load or they need to practice with a really light weight through the full range of motion. Now, let's look at a high bar squat test. Starting setup, grasp a bar with a closed pronated grip. The actual width depends on the bar position. Normally, we like to have people, the bar is on top of the trapezius with the hands hands just outside the shoulder joints, and the elbows are going to be pulled under. You got to step underneath the bar, place the bar in a balanced position on the upper back and shoulders. This is called the high bar position. It's above the posterior deltoids at the base of the neck. Now, it's okay to do this because I've had a lot of the students say, it sits on the seventh cervical vertebra in that spinal process, but you have to find what sits on top of the traps, not sitting on the vertebra right there. So you got to find that right position. Or you can use a manta ray. That's that blue thing that sits on top of the trapezius, and the bar is held there with this particular device. That's not a bad way to go too, especially if people don't have substantial trapezius muscle. Now, use a hand grip only slightly wider than shoulder width, as we previously just stated. Okay, push the bar upward from the squat stands or the power rack and take one step backwards. Position the feet accordingly. Width of the foot stance will vary depending on torso and leg length ratios. Now remember too, we did this body weight squat test, so you can start with the feet about hip width. And you can perform this test that way to see where they start to deviate with proper form. Then you move the feet out, because what we do here is try to find the optimal foot stance position based on body types. If you look at it, people with a long trunk and short legs, their feet aren't going to be as wide as somebody with a short trunk and very long legs. And we'll show you why in a little bit. With the shoulder width or wider stance, always ensure the feet are in line where the kneecaps are pointing. Once again, if you see our model here, his feet are pointed slightly out. Because remember, as you move your feet out, your hips are going to rotate a little bit, and the kneecap is going to rotate outward too. So the feet should be lined up accordingly. Rotate the elbows forward to lift the chest up and out. That means the hand and elbow should be lined up downward in a vertical path downward. So if you look at the second picture from a lateral view, the elbow and hand are lined up right underneath the bar. And they're going to stay there through the entire range of motion of the squat movements. Elbows are vertically aligned with the hands. Elbows stay aligned with the hand through the entire movement. Head looking straight. You're going to look straight ahead. Now, you're going to keep the head straight ahead, but also remember too, I know a lot of you like starting strength types of movements, especially when you're doing squats, because Rippito has you looking down. But in this particular position, the more your trunk goes upright, you can look straight ahead. A lot of times when you're doing powerlifting squats with the bar farther down your back, you're going to stick your hips back, and the trunk's going to lean forward a little bit. Your eyes might be looking down just a little bit. But even in powerlifting competitions, what we have seen is over the last 40 years, most powerlifters are looking straight ahead, looking at the judge. So you have to vary that accordingly. Maintain a position with the back flat, elbows and hands aligned to keep the chest up during the entire descent phase. Now you allow the hips and knees to flex slowly while keeping the torso to floor angle relatively constant. Keep the heels on the floor and the knees aligned over and slightly forward of the toes. Keep the kneecaps and feet aligned properly through the entire movement. You continue flexing the hips and the knees until the thighs are parallel or below parallel to the floor. So if you look here, if you look at the picture, if you look at that, the hips are well below the tops of the kneecaps. Look at the hip joint and the knee joint. That's what those segments are there, those lines going from the knee to the hip. And look at the lower leg. It's not, as you've been taught, the knees stay over the ankles and all that. You can move the knee forward over the toe and even beyond that. Because if you look at the vertical line down from the bar, it cuts right in between the hip and the knee joint, which means all the load is on the quad and the glutes. The hamstrings are stabilizers in this particular movement pattern. But look at the trunk. It's upright. You have to maintain this position. The trunk should not round or flex forward too far. The heels stay on the floor. The pelvis should maintain a neutral position and not tucked under, which is a posterior tilt. Elbows continue to be aligned vertically with the hands. If you notice in that picture, his elbows haven't moved. They're still in the same position as he started in. Kneecaps and feet are still aligned. The external line of force should drop straight down from the bar, making a straight line through the mid to the back 2/3 of the foot. And now we talked about the moment arms, because look at that. As he's in this position, look at the line coming straight down from the end of the bar. If you look at that line, now look at the knee joint and look at the line that goes from the knee joint to the line of force, the external line of force. This is called a force arm or a moment arm, and it's the perpendicular distance from the axis of rotation to the external line of force. So you can see those moment arms on the hip and the knee are almost the same, which means the load is going to the quads. For in a high bar squat, that's what you're testing. It's a quad and glute exercise. The trunk is maintained in a static position, and the movements, the dynamic movement is at the hip, knee, and ankle. Now from a front view, we're looking at the bottom position of the high bar. Once again, notice the elbows or hands are lined up accordingly. Feet are flat. Side B shows the same one we just showed before. Now look at the positions. Now the upward phase, you must maintain a flat back. Maintain the elbow and hand vertical alignment and the chest up and out. As you come up, the hips and knees, or hips and shoulders, rise at the same rate. That means they're going to come up together. You don't put your hips don't rise first, and then all of a sudden, then your back, then your shoulders rise. They should come up at the same time. Feet stay on the floor, heels on the floor, and the knees aligned accordingly. Do not flex the torso forward. Now, your hips might shift back just a little bit, because what happens is when you're coming out of that position in the bottom position, a lot of times your trunk's up a little more upright, but as you start ascending, the hips and shoulders come up. They come up at the same rate, the same positions, but the hips might shift back a little bit, because what's happening, and this is called a concurrent shift. So if you look at the muscles that extend the lower leg, they're going to work. That's knee extension, then you're going to get hip extension, and you're going to get trunk extension, and this is all done simultaneously. This is called the concurrent shift, and that's what you want. Now in the deadlift, we're going to look at the starting position. Stand with the feet flat and placed about between hip and shoulder width with the toes pointed slightly outward. You squat down with the hips lower than the shoulders and grasp the bar with a pronated or closed alternating grip. Place the hands on the bar slightly wider than the shoulder width or just outside the knees with the elbows fully extended. Place the feet flat on the floor and position the bar approximately 1 inch in front of the shins and over the balls of the feet. Now, this may change depending on the technique of the person, what you've been told by other people, so there are multiple variations of this movement. A lot of people like to shift the bar backwards over the last 2/3 of the foot, bring the hips up a little bit higher, and they're going to sit back on the whole foot. They're going to keep that bar as close as they can coming up, because what this does, this engages more of the lower body. You don't want to just use, this isn't just a low back exercise, but they can engage the entire body. You're actually pushing through the floor. It's going to activate a substantial amount of posterior chain, but you can also get the quads involved in this as well too, with the back remaining stiff and straight. Position the body with a flat back, chest held up and out, head in line with the vertebral column or slightly hyperextended. So if you look at that, look where his line of sight is. He's pretty much like, if you look at the top picture, his head isn't thrown way back with his eyes looking up. You don't want your eyes looking up. That means his head would be really hyperextended. You don't want your chin tucked down. Or I know Ripito talks about this, like putting a ball right there underneath your chin and squeezing down. But you can have that up a little bit. Doesn't matter. It's going to vary from person to person. It also depends on what biomechanics book you read as well too. Now the line of sight with the head position in A, heels in contact with the floor, shoulders over the bar or slightly in front of the bar. What a lot of people want is, if you look at A, the shoulder blades are actually over top the bar, because in this particular position, his shoulder blades are in front of the bar. You can actually shift back a little bit where the shoulder joint would be right over top of the bar as well. You're going to lift the bar by extending the hips and the knees. Think about you're holding the bar, trying to push your feet away from the body, like doing a leg press. Your back is real stiff and you're actually pushing the weight away from you. Think about the same thing. And coming off the floor, you must keep the torso to floor angle constant. Do not let the hips rise before the shoulders. Maintain a flat back. Keep the elbows fully extended and the shoulders over or slightly ahead of the bar, depending on who you like to follow or what's more efficient for you. As the bar is raised up, keep it close to the shins as possible. You don't want that bar drifting away from you, because then as that bar drifts away, you're going to put more stress on the lower back. As the bar rises just above the knees, push the hips forward to move the thighs the thighs against the bar with the knees under the bar. Because if you get just past the knees, maybe the mid thigh, you push your hips forward, your knees are going to move forward too, your trunk's going to go more upright, then you can extend the legs. This should be done simultaneously. Continue to extend the hips and knees until the body reaches a full erect position. Now, depending on the type of weight you use, you want to perform about 10 reps with strict form. Load on the bar will vary accordingly. If technique falters, stop the test. Record the number of reps completed with good technique. Now this is the same with this pulling tests are like a dumbbell lift or box lift. Now, if you look at it, look at the position that our model is in the first picture. This is like doing a sumo type of deadlift, because they always tell you, move your feet out, squat down, grab whatever object you have, and then stand straight up. This is like doing a squat test, but it's also like doing a powerlifting squat as well. Now, the protocols are nearly the same as a conventional deadlift, except this is like a sumo deadlift. The knees are outside the arms. Now, you want to maintain a flat back while lifting away from the floor and throughout the movement. Rigid torso, and use the legs to perform this movement. Try to perform about 10 repetitions with good form. The weight lifted will be determined by the equipment available. Now, for core testing, we're going to look at the upper abs. You're going to lie on a flat surface, supine position, face up with your arms overhead. You're going to push your low back into the ground. Then you're going to raise the trunk off the floor into a full sit-up position, like in position B. Low back and feet remain in contact with the floor. Tests can be performed with the hands behind the head, and that's also the Kendall protocol. Now, the grading. A normal participant can raise the upper back slowly off the floor with the low back continuing to be in the floor. Now, good, the participant has to cross arms across the chest to complete only the curling movement. Fair is when the arms must be extended forward to just raise the upper back and legs to start the raise from the floor. Poor is the participant cannot push the lower back into the floor and cannot raise the upper back off the floor. So this is a really good test of the upper abs. And of all the people that I've tested, almost everyone that I've ever tested in the last 12 years is able to do this movement. Now, for lower abs, the participant lies supine on the floor with arms across chest. Or you can have the arms on the ground as well. Just depends on what protocol you're looking at. The legs are raised at a 90-degree angle from the body with the low back depressed into the ground. Now, what you can do too, you can either put your hand underneath and feel the spinal erectors, the lower part of that, the lumbar region. You can feel it actually push into the ground. Now, what you want to do is keep your hand there, or you can use a blood pressure cuff, depending on, they can push it down and raise up the pressure in there. Now, as they're lowering their legs, they've got to keep their low back pressed either into your hand or pressed into that blood pressure pad to make sure that pressure remains the same. Now, the object is to lower the legs to the floor while maintaining low back depressed into the floor. Grading is 75 degrees, it's fair, fair minus. 60 degrees is fair, 45 degrees is good minus, 30 degrees is good, 15 degrees is good plus. And if you can lower your legs all the way to the ground with the low back pressed down, that means you've got great lower abs, and you can keep the legs maintained. If you start at any point in there, if you're lowering your legs and your back starts to move up, stop the test. If the low back comes off the ground, that's the end of the test. And then you have to look at the degrees there of the legs to determine what your score would be. Now, standards for additional tests. Many of the standards for these additional tests that we just showed you are based on norms for college-age students from multiple sources. There are no true standards for all age groups or genders for most of these testing protocols. These tests to be used as guidelines for functionality, normal human movements, and for determining improvements over time. Now, for older adults, we look at this. You can go ahead and the increased longevity requires a reduction in frailty. And that's why you need to, if you're working with the older adults, you need to find out where are they at. What is their range, their strength, flexibility, strength, and what's their overall strength? Because if you look at it from 1990 to 2003, we can look at the frailty, older than 65 years in billions. So we've increased a lot of people over the age of 65 over the last 40 years. So we need to look at that. So as we get older, we need to be able to be strong enough to be able to have a good quality of life past the age of 65. And increased longevity requires a reduction in frailty, which means you have to be stronger. Now, testing generally active older adults. we have some senior fitness tests. It's a test battery for functional fitness that the ACSM from your book shows. There's a 30-second chair stand and a single arm curl test, 5 pounds for women, 8 pounds for men. There are norms for men and women between ages 60 to 94. Normal is the middle 50th percentile, lower limit is the 25 percentile, uppers is 75 percentile. Supposedly, this correlates well with criteria and indicators of lower body strength, stair climbing ability, walking speed, and risk of falling. Now, here's the 30-second chair test. The only thing I don't like about this particular test, you can see with the gentleman standing up, he already rotates counterclockwise to begin with. So that would be an indication that he's got a compensation pattern somewhere. But the whole object of this is to sit down, stand up in a controlled fashion for 30 seconds and maintaining good form. Now, here are the norms for ACSM tests for older adults for this particular 30-second chair stand and 30-second arm curl test. We don't have to show you the arm curl test. I think most people know how to do that. But he gives you criterion for both of these tests. Now, all the previous tests we just looked at, can they be used with older adults? It can be used with precautions. Now, we must utilize all the data from the mobility and stability test as well. Because once again, you do all the same tests, posture analysis, range of motion, strength testing, and a functional movement screen. And you can do these additional tests if you would like. But you must keep the data and all that so you can see what the percentage of changes over time. Now, most of these previous tests are very safe for older adults if taught properly and performed for extensive periods of time before testing. So in other words, you got to teach them these movements, make sure they do them efficiently, then you can start adding in these tests to see what their strength levels are like. Now, how about muscular fitness testing for clients with cardiovascular disease? You should avoid testing or training in the event of any of the following, according to any of the following, until status improves or everything stabilizes and you can get medical clearance. Uncontrolled hypertension, abnormal hemodynamic responses during a graded exercise test, unstable angina, uncompensated congestive heart failure, severe orthopedic limitations, which is going to be a huge problem with people like even over the age of 40, 50 now. Arthritis is really setting in and people are sedentary, so we're seeing increases in arthritis and decreases in range of motion. And also, too, we have to look at uncontrolled metabolic diseases like type 2 diabetes. Now, testing for cardiovascular disease, you can go moderate to high intensity, 40 to 80% at 1 rep max, if is considered safe for low-risk clients who don't have any angina, no serious ventricular arrhythmias with normal activity, good left ventricular function, in other words, their left ventricle is very strong, and good cardiovascular exercise capacity. Remember back to that pyramid, the base of that general physical preparation. Even if they have some kind of cardiovascular disease, if they have good general physical preparation, they have good technique and movement patterns, and they have good work capacity, then guess what? Then they can do some of these tests. Now, the blood pressure readings, you should take blood pressure readings immediately post-exercise, and it may be lower than during muscular contractions. So you must be conservative. Don't go overboard. Hey, really push them really hard to see what can happen. So you really have to be careful here. Now, multiple repetition maximum testing with higher repetitions, it should be like 15 to 30 reps, may be preferable over lower repetition because they are more conservative in nature. So don't go too heavy, but don't go overboard with the number of repetitions you do as well. So you really have to be careful here. Now, how about children and adolescents? Now, with children and adolescents, improved muscular strength is associated with better posture. You can see kids these days, they sit all day long, they sit in front of the computer and their Game Boys and all kinds of stuff, and they have really poor posture. So getting them stronger can help increase better posture, reduce the risk of injury in any kind of their activities, improve their body composition, and can really enhance their motor skills. Now, we can make a lot of these improvements can be made even without the gains of muscle mass due to improvements in their neuromuscular function, i.e. motor learning, while resistance training. Now, why are large increases in muscle mass not seen in children? Because they haven't gone through puberty yet and they don't have any levels of testosterone. They can increase a little bit of muscle mass, but they can also get increases in connective tissue strength like bones, ligaments, and tendons without a lot of gain in muscle hypertrophy. But you can really improve their neuromuscular responses and neuromuscular function. Now, in order to assess children and assessing their muscular fitness, you have to get an informed consent from the parents or legal guardian before testing or training. Now, the push-up test and the abdominal curl testing is common. Now, max load lifting, 1 rep max to 10 rep maximum, is more often seen in youth sports centers and pediatric research centers because they have to have the right equipment. Now, however, you can use them if you can use some of these tests if you know how to teach it right. The do-I principles: describe, observe, evaluate, and instruct properly. Now, during these training assessments too, you have to give adequate demonstration. Once again, describe and observe. Then allow practice repetitions. Once again, the do-I principles. Use them strictly. Now, our conclusion: testing for all categories of strength is imperative. Remember, strength is a requirement for everything. It's a universal requirement. It's the foundation of everything we do. A snapshot of any strength deficit that needs addressing is required in your overall program design. You have goals, so you set them here, but you do the evaluation, you find out what's wrong, and then you make a business plan, just like a regular business, to try to get rid of any of those deficits. It's usually in conjunction with range of motion testing and motor learning phases of training. Remember, flexibility and motor learning, i.e. skills, are categories of strength. Increasing all categories of strength will improve functional performance in any activity. Remember, general physical preparation, i.e. foundational trainings, is imperative. You must build a foundation of strength. And one of the great things for a lot of you people out there involved in the fitness industry, if you look at CrossFit, they are basically, that's the modern day version of general physical preparation. However, be cautious here because of the fact a lot of the technique is not very good. A lot of these people don't know how to teach the proper technique. Now, while their work capacity may be really substantial and very, very good, their technique needs to be addressed as well too, because we're seeing a high rate of incidents with these types of training systems. Now, just need verification on what needs addressing first, then you can develop the proper training plan to improve all the categories of strength. So good luck, and we'll see you next time.